Hello, welcome to Holistically Speaking. I'm Morella DeVoe, your host. Our mission at Holistically Speaking is to be the avenue through which the voices of holistic health reach you at the time you need it most. And today we're talking about holistic pregnancy and childbirth. My guest today is Dr. Erin Sepic. She's my friend and also a wonderful chiropractor, applied kinesiologist, and Erin, welcome back to the show. You've been here a couple times before. We've talked about a variety of things. I think we did allergies or migraines, a couple different things. So, welcome back.
Thank you.
And we're going to be talking very specifically about pregnancy and childbirth. So, obviously, as a chiropractor and practitioner of applied kinesiology, you do a whole lot more, but this is a topic that I guess is near and dear to your heart and you're feeling particularly passionate about these days.
Quite, yes.
So tell me why. Why are you feeling like this is something that needs to get talked about and that we should have on the show?
I think probably the first point is that because it's easy to, not childbirth as a conglomerate, but I think there's so much really simple information out there that I find that most of us overlook or haven't been taught to see clearly, that it's an incredible help to labor and delivering and pregnant families. And so just ease for efficiency is great. I think in graduate school, I started specializing in pediatric and prenatal care before I even graduated. I think I was, even before I hit clinic year, I think, my last year, I was very interested in babies because one of my classmates actually had a 20-year history of migraines when he got to school. And I remember having one of our ped-specific instructors come in and show us a cranial adjustment, which didn't look like anything I thought it would, on this guy. And she asked him right away, she said, forceps delivery? And he looked at me and he was like, how could you possibly know that? Like, he has a perfectly shaved head. It's totally normal looking. How would she know that? Like, he told her where the migraine was and for how long. And she was like, forceps. And he was like, really? And I immediately thought, 20 years of migraines? Like, what?
Wow.
Like, if we can go back to the source of so much simple trauma. I mean, even, and I tell a lot of my mothers who have, perfectly uncomplicated births, but their child is colicky or torticolic or has a really hard time latching or only to one breast or whatnot. It's so easy to sort of to judge themselves harshly for something they might have done wrong. And I'm like, no. When you think about the physics of it, even the most blissful, pieced out, hippie, squat in the woods and catch your own baby, everything's awesome. That's still a lot of force on a C-spine and a head and like everything.
Yeah, it's a lot of
pressure. So it's really nice to just have a really gentle practitioner check them right when they come out because they're super smart, very in tune with themselves. And the bang for buck of a simple, very gentle adjustment, very touch, very craniosacral, is incredibly beneficial, just like for the whole healthcare system nationwide for down the road. 20 years of migraines, she fixed it with one gentle cranial adjustment.
So you're talking about adjusting the baby within a few minutes of being born?
Absolutely. I have never done that. I think my youngest was probably 5 days old, which is still pretty little. I had a beautiful month-old in today. Aww. Gorgeous. And the wee ones usually sleep through their entire treatments. Yeah. Some of the most fun that I get out of it is teaching parents how, while they're sleeping, you can read their range of motion just by their expressions and their body language, and you can tell how they're doing. Just very simply, slowly, gently, just reading their bodies because they know what's going on, whether they're unconscious or not. Like, they'll tell you, and you can work with it. And if you try to turn the child's head this way and they don't like it, just the slightest bit of resistance, I'm like, okay, that sounds good. We go back, we palpate, we do a really simple hold, and I wait for them to sort of twitch in their sleep and go, oh yeah, I didn't quite get that, and they take care of it, or they reach their arm out and it goes, and I think, wow, that's that, and then you turn them again and they're just like, just completely at ease. And then
it must be beautiful to watch.
So we get it. It's wonderful, and it's great too because both parents often get that experience, and the father having less intimate knowledge of the whole process starts to be able to see that it's not rocket science. It's very intimate, but very gentle.
So if we take a few steps back and because you say we're going to talk about pregnancy and delivery, so I'm assuming that prior to the baby being born, there's something that the mother can be doing or should be doing to make her pregnancy healthier, easier, delivery. Where does it start?
I suppose it starts preconception, optimally.
Yeah.
We all know that that doesn't always happen. Oops. So when I see people preconception who are planning to conceive, I'll often just make sure that they're on the right types of vitamins and eating the right foods that are managing their inflammatory load, and also gauge their fitness and strength level. Probably the most important thing as a primarily structural practitioner for me is to make sure that their pelvis is square and strong. Like, how is their core strength? Because once you get pregnant, you're not ramping up the core strength. It's just way too much trauma. So how strong and what sort of mobility do they have? Those of us who naturally have a lot of mobility come even second, let alone third trimester, when all that relaxin hits your system, your already loose ligaments become often destabilized, and we have a lot harder time working through stuff. So it's really important for people who are naturally really flexible to be, strong, not beefy, just like strong and stable. So if I have enough time preconception, I always address sort of the physical, structural elements, the nutritional elements, and we start talking about basic timelines.
Yeah. So for those moms and pregnant women who might be watching this and saying, okay, what can I do now that I'm already pregnant in terms of having the healthiest pregnancy and delivery that I can have? From your perspective, what are some of the fundamentals?
Perfectly. So from the largest scale, sort of umbrella perspective, what you can do is actually reduce your stress level to the minimal amounts possible. And some of that happens externally, but a lot of it happens internally. There's a lot of studies that the baby notices, and their educational outcomes are now being able to be predicted with the amounts of stress levels, which are often happening in third world war-torn countries and whatnot. But it's really interesting how peaceful the mom is. It has a lot to do with how easy the child just generally can feel everything. And it's the same thing with labor and delivery. The less stressed out you are, it being a parasympathetic function in totality. If you're feeling stressed out or not safe or not secure, it's just going to beget tension and beget resistance, which equals pain and more tension and more pain, and it's just a bummer.
Because
it's very simple stuff, but
exactly. And what you're saying reminds me of having read in the past that whatever the mother's experiencing emotionally, obviously the baby's going to experience emotionally, and almost come in with in utero memories of whatever her emotional state was. So stress management during pregnancy is a huge one.
Absolutely. And also in the plan for the labor and delivery.
In the plan for delivery.
So finding out, choosing your attendant appropriately for where you sit, just educating the heck out of yourself without getting stressed. But also, where do I want to have this child? Where do we want to be? Who do we want to be with, and why? And setting everything up, understanding that you can lay the best plans, and sometimes things just don't roll with you, and you have to be able to roll at that point, which is a key thing. But still, that's why we have these brilliant, obstetricians and prenatal specialists, and all this incredible technology. But for those cases, up until then, we really want to have, your plan A, your plan B, your plan C, things that you're okay with that you really would prefer not to, and have a birth attendant, OB, midwife, whoever is going to support that and gets you and meets you on that level, both you and your partner.
And what are some of the considerations that you think someone needs to think about when choosing their doula or obstetrician or midwife or whomever that they're going to work with? What are some of the things that they need to think about?
I think it depends a little bit on the person. Sometimes you have mothers who are who will admit to being a little anxiety-ridden or anxiety-leaning. And for those moms, I'm always very careful to recommend the hypnobirthing techniques and those trainings, same with the father, to be able to support her through that. But having a birth attendant who puts her at ease is going to be of the utmost importance. So having really good communication, very clear, compassionate, that's huge. That is totally possible in an obstetrician. We have amazing OBs here in Vermont. Some more open-minded than others, and we have the midwives right at our hospital locally at Fletcher Allen, and they are fabulous. To be able to deliver in a more low-risk, traditional female environment when the OBs are right down the hall and all the technology is there if anything goes wrong, that's pretty cool.
Yeah.
They're wonderful people. So I think, if you're super laid back, but also very cerebral and left brain, you're going to want to do all the research. You're going to want to know where you're going to go to deliver, what are all their statistics for VBAC, which is a vaginal birth after cesarean. If you're looking for that, if you've had a C-section and you really want to deliver vaginally, you're going to want to check and see, is your attendant okay with that?
Right.
How is the hospital's policy on that? What is their cesarean section rate? Am I going to be able to eat and drink when I want to? Do they have a tub, so that I can have a water birth if I want?
Right.
Will there be a stool or a ball, and they're going to let me walk around? If all of these things are important, you want to do all that research.
Right.
And just make sure that they're there with you. And if this goes wrong, what's the plan? Are you going to let me have a doula? Doulas are amazing birth support. I know you've had, what did you have on here, do you remember?
Francesca Arnold.
Right.
Was
Wonderful.
Yeah.
We have wonderful doulas around here, labor and delivery.
So you're talking about managing stress, caring for their emotional state during pregnancy, during delivery, having a plan for their birth, choosing their people, asking all the right questions. And so within the context of holistic pregnancy, what else do you advocate or say women need to think about during their pregnancy?
As far as in the moment, like in every day, looking at exercise, which fits very individually into each woman's program. So if you are a world-class weightlifter and you're getting pregnant, you don't have to stop lifting weights for a while, but you're not going to be pushing any PRs. Like that's just probably not a great idea, especially after first trimester. If you've never really engaged in an exercise program, probably not the time to start one. Probably, having some good structural care, chiropractic, craniosacral, we have like world-class prenatal yoga right here in Burlington, Vermont. Susan Klein-Lucy is brilliant at Evolution. Getting that structural support without a lot of output, just making sure good shoes and go for nice walks. But got to be mobile and strong, but not making any big changes. If you're a marathon runner and your body tells you at the end of first trimester, no more running, then you listen. Some women don't get that signal until late third, which blows my mind.
Yeah.
But as long as you are in your own body and listening to your signals, that's a huge part of what chiropractically what I do is just sort of make sure. There's a technique in chiropractic called Webster, which I'm certified in through the ICPA, the International Chiropractic Pediatric Association. And it's a chiropractic adjustment, which essentially, if you think about, I'm going to be a pelvis here, the baby and the uterus hang off the uterosacral ligaments, and they don't lay flat. They're not like this. They're always one way or the other. So there's natural sort of torsion on the sacrum, which is the big bone right between your dimples and your low back, and then you've got your two giant ilia here. And a lot of people, especially women who are horseback riders or jumpers, anyone who's landed, snowboarders here in Vermont, hikers, people who've landed and taken pelvic trauma repeatedly or ever broken a tailbone, it's a really good idea to get those checked before late pregnancy, preferably even preconception, but definitely pre-delivery, because a lot of that sets up a little bit of distortion. And if you think about just wanting that opening, that pelvic outlet to be as big and free and balanced as possible so that you have the best party outcome, it's just a really, there's science, which there's a lot of science around Webster, but there's also just sense. It's very, very gentle. So structurally, that's a lot of what I do, is make sure that this woman is getting the support that she needs structurally. Is she in the right shoes? Does she need orthotics? What is her exercise regime?
And is she doing the right activity for her level of activity?
I mean, a lot of people, and we've seen some of these CrossFit videos out. It's been really interesting to watch, like some very pregnant women still CrossFitting and doing kipping pull-ups and whatnot. I've been kind of horrified at some of them and really kind of inspired by others. Heather Bergeron did a great interview. She was at the Games last year with an 8-week-old baby.
At the CrossFit Games.
At the CrossFit World Games. With a 2-month-old child, like postpartum. That blew my mind. Like I didn't actually think that was a terribly wise move, but she really had a great perspective on it. She really did. And she had very clear priorities, and it was baby, not CrossFit. Right. This was a bonus.
So it's fitness that really matches the woman's level of fitness and maintaining it, staying active.
Having been a world-class athlete for years, this wasn't a big change for her.
Right. And it plays a huge role in things like avoiding gestational diabetes and things like that.
Making sure you're on the right diet for your, and working with somebody like you for nutritional counseling, trying to figure out where your inflammation markers are. Have you done prenatal preconception blood work? Do you know, are all your numbers simpatico?
Right.
Great. If they're not, maybe we work on some of those things. You know, really focusing on whole foods, not a whole lot of sugar or alcohol, obviously.
Yeah.
Just making sure that, you know, constitutionally you can use Ayurveda, you can use acupuncture, you can use the blood type guidelines. There are so many different ways, but it's all filtered to, right now, for me, what does my body asking me for?
Right.
And we have people like you to help us figure that out. Because we're not, you know, we want to just know it all, but we just don't. Like, reach out for the support that you need and be confident about it.
So let's see, we have managing stress, planning for your birth and choosing the right people, asking the right questions, staying active to the right level of activity that you've been doing and that your body's telling you is right. Obviously getting adjusted or getting care with you
aligned,
as early as possible, pre-conception, observe, you know, making sure that their structure is supported, that they're staying.
It's like an assessment and a good check. And it's great during pregnancy. It's usually not that frequent early on unless there's some pre-existing conditions. But later in the third trimester, there's a lot of stuff to make room for.
I was just going to ask you, so what are some of the issues that you see during pregnancy that you can help with, that maybe some of our viewers watching this saying, you know, I'm in my second trimester or third trimester and I'm feeling, what are they feeling that you can help them with?
Right. Physically, a lot of moms, especially in the third trimester, a lot of my new patients come in the third trimester, unless they've heard about me or they're working with a midwife or a doula who's, you know, connected. And they'll come in with hip pain, coccyx pain, a lot of low back pain, some groin pain, knee, ankle, head, neck, all that stuff, but most commonly right around the pelvis, front or back. Because there's a lot of strain on there, and it's literally getting like blown out from the inside. So depending on what we were talking about as far as mobility and strength and stability, and are they chasing a 4-year-old and a 2-year-old?
Yeah.
Man, you know, like that's just not an easy thing.
So your adjustments on a pregnant woman, especially if she's in her third trimester, I would imagine are quite different than the classic chiropractic adjustments.
That's a great
you know,
point,
like the back cracking kind of thing. What are they like?
I actually, and we've just put on some new videos, I think, on my website, because I think a picture says a lot, but a video says more when you're talking about stuff like this. It's the same with the babies and how they sleep right through it. It's a little bit like you get kind of, whoa, chiropractic for an infant. It's the same sort of thing with pregnant moms. It's very, very gentle. I've got some giant Tempur-Pedic pregnancy pillows that are carved out. There's a big one and then a littler one, so you end up getting like 8 inches of lift, and they crawl up and they lay down their belly.
The belly
and
inside
then the breasts on top, exactly.
There's like a hole.
It's perfect. And they lay down and they just go, oh gosh. And then I get perfect access to their pelvis and their sacrum, and we get to align them. Really gentle tests, muscle strain for asymmetry, and I can look and actually, you know, tell them what I'm seeing, and does that make sense? We do some really gentle trigger point release. There's a lot of spasming in the gluteal region around, especially late third, if they're hypermobile. If they're starting to open up prematurely, the glutes will spasm, and it can be really painful.
Oh, wow.
But if we got them to let go completely, like if we were to beat them into submission, then the pelvis would be unstable. So there's a very delicate, then you know, she'd feel great on the table and she'd stand up and take a step and you know, like, wait a second. So it's really neat to sort of, it's a constant dance with each individual person. Like, how do we alleviate this pain without going too far? Because you need this stability. And it's a little bit of a dance for the last 6 weeks or so for some women. Some women don't even notice it. You know?
So as they head into childbirth, what are some of the considerations that you would like our viewers to see? Okay, so you're heading into childbirth, and now you've chosen your team. You've asked all the questions. You're feeling that this is the right team for you. This is the right setting. What other considerations?
The main stuff, I guess, is to understand sort of the neurology of it, being in that sort of sympathetic space versus that parasympathetic space.
So for our viewers,
so your fight or flight is your sympathetic, and your rest and digest and labor and delivery is
so
really
the place
here.
of ease.
Exactly. So
which
anything
is really contradictory to what we would imagine at labor. You know, it's like this high tension place, and what you're saying is labor actually is
Yeah.
a function
The
of
goal.
that rested, not stressed
Things go
nervous
so much
system.
better when you're, and any clinician who does anything structural understands that and massage therapists, absolutely, the spiral that is tension begets pain, begets more tension. In response to that pain begets more tension. And it's just like, it just doesn't stop. And it's such an intense experience that if you're not confident and supported and feeling that you're in the right place with the right people,
Right.
and that everyone has got you
Right.
dialed, like everyone is looking out for you and your baby, it's really hard to really relax with that.
Yeah.
So it's really important to just have that filter, like walk through the hospital and say, you know, is that going to make me nervous or not? Or how do I prepare for completely not letting that
And I think, you know, with childbirth is probably the best example of that spiral, downward spiral that you described,
It's pretty
where
incredible.
when women are afraid or anxious, you know, they tighten up, they feel more pain, they get more, you know, more anxious, feel more pain, get tighter, and it just gets worse and worse. And, you know, if
And
they
you end
did
up
the opposite.
arresting, yeah. So the labor stops and everybody wonders what's going
So
on.
what are some things that women can do to help them be in that
So
parasympathetic
one of
rest
the
and
best
digest
things I could
place?
possibly recommend is this book right here,
Hypnobirthing.
Hypnobirthing by Marie Mongan. She does an incredible job of there are a lot of wonderful books out there of explaining how to stay in that space and how to go deeply into your body, as opposed to paying attention to a class of interns that may have just marched in. Like, who knows? They don't really matter. What matters is here. And this fellow is my hero, Grantley Dick Reed, Dr. Reed, from Britain. He died in '59 after a brilliant career in obstetrics. He was the first one. He published Natural Childbirth in 1933, long before obstetricians were really open-minded to natural childbirth, because the doctors only ever saw the complicated cases, right? Everybody else was at home with midwives. But by the time they got to the hospital, so obstetrics, I think, sort of evolved as a discipline for managing risk, which, boy, they're good at it. We appreciate when we're high risk to have that kind of support, and all the technology that we have now is mind-blowing. But to keep it as low intervention as possible when it's not a high-risk situation is intensely, like, it's just essential. And hypnobirthing is a sort of a refined system based on all the research that Dr. Reed did around natural childbirth. I mean, he got blown up in World War I as a soldier and then delivered babies all the way through World War II. And he watched women in impossible circumstances have the most blissful, giggly births in the middle of nowhere. Right. It was just like, what? And he went through and he did more and more research, thousands of case studies, and really, you know, put it out there, made it accessible to obstetricians. Thank goodness. And now I think Marie has done a wonderful job, and we have lots
And correct me if I'm wrong, but I seem to remember some statistics on there being fewer neonatal complications when there's a little bit more of a care for intervention, like holding back intervention and rushing the birthing when not necessary.
Yeah, there's a fair amount of studies out there, actually. This is another wonderful book, Obstetrical Myths versus Research Realities by Hensi Goer, and she really went through the data and published in a reader-friendly way. Like, the study abstracts are all there, and she went through with her analysis. And it's fairly clear. Dr. Dick Reed found it, like, over his whole career, but everyone told him that it wasn't scientific. He was just like, I have a mountain of anecdotal evidence, but it's not the kind of thing that you can really do a double-blind, peer-reviewed study
So
on.
perhaps it's a good opportunity to show our viewers some of the books that you brought. This one, however, is Obstetric Myths. And I'll just show it, hold it, Obstetric Myths versus Research Realities by Hensi Goer. But we also have a few that we could show our viewers. If we can show that first screen. So, Childbirth Without Fear, that was the one that you were saying was written in the 1930s?
Yep, he wrote, this was published, I think, in '53 in the U.S. under this title, but it was published in Britain and in Europe under Natural Childbirth in '33. I'm not sure why they changed them, but that was really the start of the whole movement.
And then Hypnobirthing was that other one that you showed viewers by Marie Mongan.
I mean, if you go for the testimonials on the hypnobirthing.com website, it will blow your mind. Women who've birthed under all sorts of conditions, their testimonials will sell it. Plenty.
Wonderful. And then Gentle Birth Choices by Barbara Harper. And what's this one about?
This one sort of is a great overarching book, and they have a huge kudos from endorsements from Midwifery Today and Lamaze International.
Okay.
Very great sort of whole umbrella addressing of things that need to be thought about and how to proceed with compassion.
Then on the next slide we have The Spiritual Midwifery that you just mentioned by Ina May Gaskin.
Ina May Gaskin is a legendary midwife, and she wrote this way
So
back
this
in the
is
70s.
likely more about the spiritual
You'd think.
view.
She actually covers a fair amount of physiology, though, and neurology, I don't think, without meaning to. But midwives, I mean, she puts it succinctly and beautifully. A lot of the midwifery wisdom that we have at our fingertips.
Active Birth by Janet Velasquez. What's this one about?
That's a great one. It really sort of just further empowerment and expansion on the theme of childbirth without fear, as opposed to passive childbirth. I think is like a statement of what like our grandmothers went through, where you showed up and got your epidural, got full systemic anesthesia, and like woke up with a baby. That's passive birth. So
Well, I would say more like our mothers.
my grandmother. I don't
really?
think. Yeah.
Okay. And then
I think I was in Canada. Maybe it's a little different. We're a little delayed.
my grandmother had all her babies naturally.
Oh, good.
Yeah.
Yeah.
And then Birthing from Within is...
Yep, it's a very similar, these are all sort of classic, sort of top tier books on natural childbirth. So regardless of where you end up, like if you're in a hospital, I was just looking up midwives in Sun Valley, Idaho, and there are none. There's one physician out there who attends births and that shows up on Google anyway. So it's not necessarily going to be your perfect situation, but if it's not going to be what you would prefer, going through and doing this sort of background reading is a great idea, and you can even better prepare yourself.
Oh, wonderful. So then here we have a few websites that our viewers can access, hypnobirthing.com, doulasofvermont.org, I imagine is a resource to look up who the doulas are, vermontmidwivesassociation.org, and ICPAforkids.org is what?
And that is the International Chiropractic Pediatric Association, and you can locate a chiropractor in your region who has a Webster certification for pregnancy, prenatal chiropractic.
Oh, wonderful. So ICPAforkids.org is prenatal chiropractic, and synergichealth.com is Erin's website.
It's my practice website, and it has a fair amount of background on why I do what I do and what the benefits can be. So it's just nice extra reading. We've got good links on there, and videos of what you can anticipate.
So Erin, thank you so much. You've walked us through so many different things that our viewers have been able to hopefully take in about stress management, prenatal care, preconception even, in looking at their structure, getting chiropractic support, getting evaluated, staying active, but getting also some recommendations as to what's appropriate and not so much for their
a great birth attendant is
and choosing their team. So for our viewers, if you would like to get more support and more guidance, if you're pregnant or considering being pregnant, definitely visit Erin's, Dr. Sepic's website and get some support. I hope you found this as interesting as I did, and I look forward to seeing you next week.
Thank you so much for having me.